Hello, Rancho Cordova residents and businesses. I'm Rancho Cordova City Councilmember David Sander, and I'm also a virologist, a scientist specializing in the study of viruses. I have exciting news to share with you about the COVID-19 vaccines. Sacramento County Public Health, healthcare networks, and pharmacies are continuing to vaccinate people to safely protect them from COVID-19. A number of people have been able to get the vaccine, including those 65 and older, people with certain health conditions, and those employed in certain sectors. Now, individuals 50 years of age and older can get a vaccine, and soon anyone 16 years of age and older will be able to get a vaccine. This announcement is a huge and hopeful step towards getting our community back to normal. As more and more Rancho Cordova residents get vaccinated, we wanted to answer some of your questions on the COVID-19 vaccine. Let's get started. Appointments are required for vaccination and are available on a first-come, first-served basis. Make an appointment online through Sacramento County, or check with your healthcare provider and local pharmacies. Start with their websites for information. Links are available on the city's website as well. Just look for coronavirus information. You may receive one of these vaccines that have been approved for emergency use: Pfizer, Moderna, and Johnson & Johnson. The Pfizer and Moderna vaccines require 2 shots to get the most protection. You must get both doses from the same manufacturer to get full protection from the vaccines. Pfizer doses should be given 3 weeks or 21 days apart, and Moderna doses should be given 1 month or 28 days apart. While you should get your second shot as close to the recommended timing as possible, you can still get your second shot after these times if, for example, a second dose is not yet available. The Johnson & Johnson vaccine is a little different. It requires only 1 shot. The COVID-19 vaccines are highly effective at preventing COVID-19 disease. However, like many vaccinations, it takes time for your body to build protection after being vaccinated. People are considered fully protected 2 weeks after their second dose of the Pfizer or Moderna vaccine, or 2 weeks after the single dose of Johnson & Johnson vaccine. Yes, according to the Centers for Disease Control, or CDC, you should continue to wear a mask and to social distance. Why? Well, as I just mentioned, there's a time frame where your body is building up immunity after you receive the vaccine. Plus, if you do contract COVID-19 after receiving the vaccine, you may be asymptomatic, but still capable of passing along the disease to others. This can happen when you are infected and the virus is replicating, and before your immune system responds to eliminate the virus and stop the infection. That little window of time between being infected and your immune system responding could lead to a vaccinated person being infectious. Not getting sick, but being infectious. More studies are going to be necessary to determine how much of a risk that is. So continue to wear the mask and practice social distancing until we have more information. You know what vaccines really do is protect you against serious disease, and these vaccines are essentially 100% effective at doing that. On Monday, March 8th, the CDC announced the first set of public health guidelines for those who have received the COVID-19 vaccine. Fully vaccinated people can, 1, visit with other fully vaccinated people indoors without wearing masks or physically distancing. 2, vaccinated people can visit indoors without wearing masks or physically distancing with unvaccinated people from a single household who are at low risk for COVID-19. And 3, they can refrain from quarantine and testing following a known exposure if they have no symptoms. Those are the benefits of being vaccinated. But for those who are not fully vaccinated, you should continue to wear a mask, maintain social distancing, and avoid gathering with non-household members. Herd immunity means that a whole population can be protected from serious disease when enough people in that community are protected from getting COVID-19 because they've already had it or because they've gotten the COVID-19 vaccine. Because so many people are protected against COVID-19, the disease, herd immunity would make it hard for the virus to spread at all. And the great thing is it would even protect those who cannot be vaccinated, like newborns. We are still learning how many people would need to get COVID-19 vaccine to achieve herd immunity. However, getting the vaccine is the much safer way to build protection against the virus instead of getting sick. Do you have more questions about COVID-19 vaccines? Visit the city's coronavirus webpage for comprehensive questions and answers, or call City Hall if you don't have access to a computer. We can help protect our community from COVID-19 and get back to a state of normal, Rancho Cordova, but we can only do it together.